Hi, welcome to the acute back pain technique section. These exercises are specifically designed for individuals who have acute low back pain. Some of you may just want to watch these exercises prior to doing them, especially if you're having significant discomfort. What you will need for this program is a comfortable surface to lie down on or an exercise mat, a small pillow, and a chair to help with some of the strengthening exercises. Please wear appropriate athletic footwear and comfortable clothing. If at any time during this section you experience discomfort, please stop what you're doing. Review the technique. If pain persists, you may want to consult with your physician. Let's follow Paul as he demonstrates the exercises for us. Let's begin with some gentle stretches. The first one is single knee to chest. Lying on your back with your hands behind your right leg, gently pull your right knee to your chest until a comfortable stretch is felt in the lower back and buttocks region. You will hold this position for 15 seconds and then relax. Let's repeat that with the opposite leg. Bring it back down. The next exercise is the double knee to chest. Again, lying on your back with both hands behind your knees. Pull your knees into your chest again until a comfortable stretch is felt in the lower back. You will again hold this position for approximately 15 seconds. Okay, let's try that one again. Bring the knees upward slowly. Hold them. Comfortable stretch and relax. The next exercise is lower trunk rotation. Again, in the same position on your back, knees are slightly bent, both feet are together on the floor. Gently rotate your knees first to the right. Hold this position for 15 seconds, maintaining your shoulders on the mat, and then gently bring your knees back to the opposite side towards the left and hold that position again for 15 seconds. Bring them back to the center, and let's repeat that one more time. To the right, you will hold that for 15 seconds, maintaining shoulder position. You will rotate slowly back to the opposite side, to a comfortable position, and again hold that for 15 seconds and return to the center. The next exercise is the pelvic tilt. Lying on your back, knees again will be bent, feet on the floor. You will use your stomach muscle and buttocks to push your lower back into the floor. You will likely feel your pelvis tilt upwards. You will hold that position for again 15 seconds and relax. Let's do that one again. To try and make sure that you feel as if this is working, you can put your hands on your hips and you should feel them tilting down towards the floor. Relax. The next exercise is the leg raise. Lying on your back, both hands will be placed behind your right knee. You will pull that leg upwards, trying to maintain a straight leg position. You will hold this position for 15 seconds and you will lower your leg. Let's repeat that for the other side. Hold this position for 15 seconds, feeling a stretch in the buttocks and lower back region, and relax. The next exercise is the mid-back stretch. You will assume a kneeling position on the floor. You will gently bend forward using your hands for support and slide your hands as far away as possible. Try to put your head on the floor if at all possible. You will hold this position for 15 seconds and then return to the kneeling position. Let's repeat that one again. Gently coming down, reaching forward, and allowing your head to relax between your arms, and hopefully gently place this on the floor. Let's return to our kneeling position. The last stretching exercise is lumbar rotation. In the standing position, you will cross your arms and rotate your trunk from side to side in a small, pain-free range of motion. This motion should be fluid. As your back becomes more comfortable, you can increase the distance with each turn. And return to the starting position. The next set of exercises are active motion and gentle strengthening exercises. These exercises should not cause you any increased back pain. If you are experiencing any increased pain, please stop the exercise and review the technique. It may be appropriate for those of you with significant pain to only do the stretching exercises at first. As your pain improves, you can add the motion and strengthening exercises. Let's begin with the first strengthening exercise. That is the forward-backward lift. In the standing position, legs wider than shoulders, hands easily overhead, you may slightly arch your back backwards. To a slow count of 4, gently bend forward from the waist towards the floor. Return to the standing position to a count of 4. Your movement should be constant. The next exercise is lumbar rotation. In the standing position, again, legs wider than shoulders, hands placed on your hip, gently bend at the waist and rotate in a circular motion. You will rotate both clockwise and counterclockwise. The next exercise are the press-ups. Lying on your stomach, palms down, shoulder width apart, gently press your body upwards. Keep your hips in contact with the floor. Your low back and buttocks should remain relaxed. You will hold this position for 10 seconds and then relax. Let's do that one again. Bring it up. Hold that position for 10 seconds and come back down. The next exercise is the hip extension. Lying on your stomach with a small pillow or folded towel under your belly for support, hands should be comfortably in front. Lift your right leg 6 inches off the floor. Keep your knees straight and hold this position for 5 seconds and relax. You will repeat that for the other leg. Bring it down. The next exercise is called the arm leg lift. This is the same exercise that we just did, except you're also going to lift your opposite arm as you lift that leg. So let's start with the right leg and left arm up. You will hold this position for 5 seconds and relax. Let's repeat that with the other leg and arm. And bring that down. The last strengthening exercise are the chair crunches. Lying on your back, you will place your legs comfortably on a chair. Keep your arms folded across your chest. Tilt your pelvis to flatten your back. You will raise your head and shoulders slightly off the floor, maintaining a relaxed neck position. You will lower back down and relax. Let's repeat that. And bring it back down. Now you've completed the technique section. Please review these exercises until you feel comfortable. Once you feel comfortable, you may go to the appropriate back program.